My name is Georges L'Espérance, and I'm MAID assessor and provider in the province of Quebec. So we'll be speaking to what the MAID application process looks like in Quebec. In fact, in Quebec, it's almost the same than in the rest of Canada, except there's a couple of main nuances or something that you must know what is going on in Quebec. So in Quebec, if you want to have MAID for yourself, for sure you have to sign the form, the request, MAID for request form. So as in Canada, you have to sign yourself. If you're not able to sign yourself for whatever the reason, you can ask somebody to sign for you, but that person must be, of course, apt to sign and then must know you and also should really understand what is the MAID request. So that's what is going on. So the first thing is to sign the form. You can find it anywhere or perhaps on our site on aqdmd.org. You can find that request over there. Also, what is important, on the request, there is a place where it's at the beginning where it's written, I ask to doctor, anybody else, to do the MAID for me. Well, you don't have to write the name of a doctor at that time, okay? So you just have to sign your request by your name or somebody who can help you to do this, and then one witness, and then there's another witness. So that's the difference in Quebec. Beside all the rest of Canada, you have to sign, we have to have the witness by a health professional, first signature. Well, the first one is yours. Second one is that of the health professional, and the third signature is one of a witness for that time. Second thing is that you need to have a witness to sign that form. So that witness, like another place in Canada, maybe your doctor, but also maybe a nurse or maybe a social worker. Well, anybody who is in fact registered as a health professional with a number of her profession. So anybody can sign that form if he or she is a health professional. If you're struggling to find a witness for your form, you can contact directly the Professional Services Director in your CU-SSS, or you can ask anybody else. You don't have to ask to your doctor if he doesn't want or she doesn't want to sign the form. So you have large choice to have your request signed and done. So once your request, is filled up, you must send it, or the doctor can send it, or the social worker can send it to what we call the regional hospital, which is in Quebec called CUSSS, and you send that form to the professional director or directeur des services professionnels, professional services director. So that person in your CU-SSS will be able to send the file to a doctor who can evaluate you. Remember, in Quebec, only doctors can evaluate you as a patient or can process to MAID. What about the assessment process? Well, the doctor who's going to evaluate you is going to meet you, perhaps the first time on phone, and then he will look at your file, your hospital file or your health file, and he will meet with you. It's mandatory to meet with you, of course. And then your doctor will ask many questions. Perhaps he will do that with a nurse, or perhaps he will do that with a member of your family. It's your own choice. That's it. You choose whatever you want to be with you for that interview. That may last 1 hour, 2 hours, it depends of each case. Where can you have MAID? Well, you may have it at home if you want. You may have it in the hospital if you don't want it at home. Well, anywhere where you want, you may have your MAID, but you have to just do the arrangements with your doctor. Also, it's you that decide what person you want to have in your place with when you will have MAID. It's only you that decide that. nobody else. So how long does it take? Well, the day and the hour you decide, the doctor will be there, perhaps with a nurse that will be sure that the two venous access are okay, so that the process will be smooth. And then it will take a few seconds that you will lose your consciousness, and after that the process keep on. So what is important to know is that after 5 to 10 seconds of the beginning of the injection, you will not feel anything, and that will be your dying process going on. It takes something around 10 minutes. And also what is very important is that all your requirements, funeral requirements, have been done before, of course, with a member of your family or somebody you trust in. So that must be done before. If it's done at home, the funeral home will come to pick up the body, and then will do whatever you ask in your funeral wills before. If it's done in the hospital, normally the body will be descended in the morgue, and then they will be processed with the funeral home.